10 p.m. We're going to start the meeting now. I'd like to call the meeting to order. Can I get a second?
Second.
Thank you so much. The mute button's still a difficult thing to adjust to. So first off, Happy New Year to everyone. Thank you so much for joining us back here. I know it's been some time. We clearly have a great deal of different matters that came up throughout the past month. I'll be trying to give a few updates tonight about really just a number of things. But on today's agenda so far, I just wanted to note that we have Regina from the Community Options Inc. organization that was gracious enough to come and join us tonight, speak to us a bit about their organization and give us the opportunity to ask questions and learn a little bit more about the work that they've been doing. And second off, I continued pretty much another section for tonight that's going forward with hopefully getting a resolution out addressing the matters that we've been talking about since back in 2014, dealing with the Fort Washington Avenue Armory. So, I mean, those are just two of the major items that I've put up tonight. I also will then, in the new business section, be talking about some of the updates that we still have going for us on some other issues. So with that, I just want to open it up for my entire committee to introduce themselves. My name is Ariel Miranda. I'm the chair for the Housing and Human Services Committee.
Hi, I'm Osi Kaminer, the assistant chair.
Good evening, everyone. Leo Jimenez.
Good evening, everyone. Marielle Ali here.
Good evening, everyone. Aisha Ogilvy here.
Okay, and I think that should be everyone on the committee. Members of the public, would you like to introduce yourselves?
Well, if I could just jump in, Marshall Vanderpool, public member.
Yes. And I apologize for not specifically making sure you got the shout out there. Thank you so much, Marshall. So members of the public, I think you should be able to unmute if you're not.
Hi. Hello, everyone. I'm Dr. Gary Altheim, the Executive Director, founder of GDS. Used to be located in the New York City Fort Washington Armory until we were wrongly evicted. Nice to see everyone. Happy New Year.
Happy New Year. I'm Jane Kopp, and I'm head of the Condominium Association at Edgecombe Park, where there are two community option group homes in two different units.
Bill Zablocki, Advocates for Equality and Integrity, born and raised in Washington Heights on 166.
Hi, my name is Kerry Brady, and I am the New York State Director for Community Options, Inc. I'm joining Regina on this call.
Hello.
Hi, everyone. My name is Zadie Adams. I'm GDS Growth Development Services Community Liaison and Program Coordinator.
Okay, so I think members of the public might be a little shy at the moment, but no worries. We're happy to move on to the first topic, specifically the presentation by Community Options Inc. I want to thank Regina for again being here tonight. It is a genuine pleasure to be learning about the work that you're doing. We certainly have not had as much of a grasp of the work that is being done right here in our community. It's very crucial and important. I'm sure, this entire committee and the public really does appreciate this opportunity. So thank you so much again. And with that, I'll allow you to begin.
Okay.
So good evening. I'm Regina Taylor Tuck, the Executive Director for the New York City region at Community Options, and Carrie Brady, who is our State Director, is on the call as well. Carrie.
I am here.
Okay, okay. So I guess a synopsis of what Community Options is and does. So we are a nonprofit agency funded by the state, and we provide services for people with developmental disabilities. Those services range from day services, employment, to residential, which can be a 24-hour setting, as well as a individual setting where the person lives independently and receives services through us. The two apartments that are located on 167th Street, 456 West 167th Street, are actually two 24-hour residential programs. What that means is that there is staff on duty 24 hours a day, 7 days a week. Was there any specific questions, or you just wanted to know what in regards to the agency?
Regina, sorry, it's Carrie. Is that all right? I apologize if I just could add a little to that. So,
Sure.
So Community Options Inc., as Regina said, is a nonprofit in New York, and in addition to providing services and supports for adults and children with developmental disabilities, we also provide support to people with traumatic brain injury, people that are under what we refer to as the nursing home transition programs, where we provide services to people and supports in the community. We are also assist with employment. We assist people in their homes. So, for example, someone may be transitioning from a nursing home back to their home, and we would provide home care to them. This is for anywhere from Manhattan. We're located in Queens. We're located in Brooklyn. We're also located in upstate New York. And we are a national company in that we do this in 10 other states and support in total over 5,000 people so that they can live a quality life, independent, with their families if they choose, and with the right supports. And yes, we are in 167th Street and two apartments there.
Do any of the committee members want to start off with any questions that they might have?
Yeah, I have one. Why only 2 apartments?
Why only 2 apartments? Meaning you think we should have more or less?
I would think that you guys probably did your own research and you know how many you need in our district. But I feel that 2 is too few. Like,
oh, well, the 2 apartments in 167th Street are only in that particular building. We have multiple locations in, as I said, in Queens and in Brooklyn, other locations in Manhattan, upstate New York. We have hundreds of residences throughout the country.
right, but my question is if you think about a district, it's roughly 210,000 people, residents of Inwood and Washington Heights.
Mm-hmm.
I feel that 2 apartments may be too little. So I wonder, I understand that you have apartments in other locations, but I'm looking at our district, so I wonder what's the reason why only 2?
I see. No, thank you for clarifying. I understand. So it's a great question. And what happens is the people that we support, along with their families, want to live in certain neighborhoods, meaning their family may be in Queens, so they want to live in Queens, and somebody may want to live in Manhattan, or somebody may want to live upstate. So we build the supports around what the person wants and needs, and mostly it's because they may want to be close to their family. So we may just not have anybody right now that is looking in the Manhattan region. For example, right now, we have a handful of people that are looking, they want to live in Westchester County because that's where their family is, and they want to be close to their family. So it's really based on the needs of the people that we would be supporting.
So I'll actually just ask, being that you're, I guess, in a sort of partnership or relationship, let's call it, with New York State, how do you work alongside New York State's government in order to then establish these relationships with these clients and then have them be brought to, whether it be the individual units you own in Manhattan or Queens and Bronx? How does that typically play out?
Certainly. So when when you under the New York State Office for People with Developmental Disabilities, so they are under the Department of Health, and just like a child would qualify for, let's say, early intervention or other services, you are deemed eligible, and you're deemed eligible based on your diagnoses. So the primary diagnosis is a developmental disability. This could mean an intellectual disability. This could mean autism. And then the Office for People with Developmental Disabilities is then responsible for connecting that person with a case manager. And the case manager then builds the support. So, for example, one person may want to continue to live at home with their own family, and they're really just looking for employment services or a day or school or day services. And then another person may actually be looking for residential placement, which I will say can happen. And it might be a case where, somebody has lived with their family their whole lives, and mom and dad are maybe aging and are not able to care for their adult developmentally disabled child anymore. So they start planning, knowing that they need to have a plan, a life succession plan. So it's really dependent on what the person needs. The service authorization is through the state, through the Department of Health. And then they will then select which provider that they want to provide them the services. So I'm not sure, in Manhattan, there's large organizations similar to ours. There's AHRC or a YAI. There's several, but they may have a connection with Community Options because maybe they received employment services from us, and then they may come to us as the case manager and say, we're now going to be looking for a residential placement for this particular person because mom and dad are aging, or maybe the person themselves has indicated, I'm ready to try independent living with supports, and I don't want to live with my mother and father anymore. But all of this is under the Department of Health, and that is who our governing body is, and we have to maintain good standing with them. So they oversee the operation. We are held to audits where it could be everything from a physical inspection to a review of our records. But in all, the Department of Health and OPWDD partner with the nonprofit provider to make sure that the right support goes to the right person.
Thank you so much. Do any of my fellow committee members also have additional questions?
Yes, this is Aisha Ogilvy. So my question is, first, is community options related to a matter that came before us in the beginning of the session? I'm not sure if is Janet Wolkoff the person that may have brought the, I don't remember the name of the woman who
that was me.
What, yeah, so I just wanted to try to make the connection to why they were before us. I think I may have missed where that was stated. So my questions would be related to what is the capacity of the apartments that that Community Options has in our community, and what are the types of services that are being rendered? What types of supports are there available? And any issues or concerns that may have come up during the time that these apartments have been here, and what is the duration of the time that this facility has been in our district?
So I may need to rely on Regina. So I'm fairly new to Community Options. So I believe, Regina, they are 2-bedroom apartments.
Yes, they're both 2-bedroom apartments, 3 individuals in each apartment, and there is 24-hour staffing.
Right. And so what happens is with 24-hour staffing, what it means is the support of the staff member could be anything from assisting somebody to learn how to do their laundry. It could be assisting somebody to learn how to prepare their own meals, taking them to the bank so that they know how to deposit money and take out money. It could be transporting them and assisting them to get to their medical appointments. So it's services by a staff member that helps them become more independent in their living. While that's the supports we provide, I would not be able to shed light on anything, as I said, that it was of concern at this point. I'm fairly new with Community Options, but I'm sure that if there was anything that was of concern, I'm sure that Community Options would do everything in their power to rectify the matter.
Okay, and just out of curiosity, is there a specific type of focus that in these 6 individuals that are in our community? When I ask that, I mean in regards to whether it's a foster care, foster age, yeah. What is the population that is being served there?
Right. So as I mentioned before, so everybody that we serve, because we are under OPWDD, has a developmental disability, which means their primary diagnosis is that they are intellectually disabled.
Okay, thank you very much.
Sure.
Any other members of the committee?
Yeah, if I could jump in. I was wondering if there was I mean, when you mention autism, is there like a capacity range that you would not be able to assist the individual or something? I mean, I'm thinking about an individual that might be nonverbal, and I believe they're like 29 now, and they're being cared for by the family. I guess the mother's in her mid-60s now, and I'm just wondering what could be done for a family like that.
And thank you, sir, for saying that, because what you just described would be exactly what Community Options does. So the range of intellectual disabilities can be from somebody who's mildly intellectually disabled, which means they are a little bit more independent and they may be able to hold a job, and they may be able to take care of themselves somewhat. And then the other range, which we do, is you may have a child who's now aged to the point where I just said they're 29 and they are autistic and they may not speak, and they may need full assistance with everything from eating and dressing to just accompanying them in the community. So we would be more than willing, sir, if you wanted to make contact with us, Regina and we could give you our phone numbers, and we'd be more than willing to help this family, because that is exactly what we do, is that we know that in a situation like that, mom is probably hitting her 60s, and caring for your 29-year-old autistic child can become a little bit tough as you get older, and that's where we can help. So we'd be more than willing to help and have a conversation, of course.
Okay, well, if you could drop your information into the chat lines, that would be excellent. Thank you.
Of course.
Are there any other committee members that also had questions about the work that they're doing?
Not a question, just a comment that I just found. You guys came to us on 2014 to get an approval for those 2 apartments, right?
Yes,
I just found the agenda from, when was that? That was October of 2014.
Yes, it should have been back then. I wasn't involved, but I know that we moved the first individuals in April 2015. So
oh, wow.
That would make sense.
Okay.
That definitely would make sense that the approval would have been requested in 2014.
Okay, great. Thank you.
Can I ask, in regards to the staffing that Community Options uses, can I ask where it is perhaps that you might find the individuals that service the clients that are within that very building? Is there specifically sort of?
Yes, no, of course. So what happens is, so we people apply for a job. Depending on the position, it may be somebody that, for example, if it's somebody that we're looking for that's a behaviorist, we may require a degree in psychology. And in other cases, it would not. However, anybody that does apply and for a job at Community Options has to go through a very, I'm going to call it somewhat cumbersome process to be hired, because under New York State guidelines, we require fingerprinting, we require a criminal background check, we require a what we call the statewide child abuse registry check. So there's a 6-point check that has to be completed for any person who's applying for a position at Community Options, and you have to have passed all of those in order for any employee to be hired. And that is, if I may, that's not only a requirement for Community Options, it's a requirement for any nonprofit provider such as ourselves under OPWDD guidelines. And we're actually audited by the Department of Health on a regular basis to make sure that we abide by those guidelines.
Thank you. And can I ask, is there specific training that's required, whether it be by the state or that even goes further beyond what the state requires by Community Options for those individuals being hired to service clients in your programs?
Yes, absolutely. So there is a state required curriculum that any new employee has to complete within the first week of employment. So when we hire anybody, they go through a new staff orientation, which is about a week long. There are certain state mandated topics, and this can range from nursing to fire evacuation to incident reporting, and then it touches on working with developmentally disabled adults or children. And then what happens is after you complete your state mandated curriculum, then the training becomes specific to the people you're working with. So for example, I may be working in a residence in Queens where I will be working with somebody who may be in a wheelchair and who may need assistance feeding. So I would be trained on their diet and how to make sure that they have the right consistency of diet and how exactly under the nurse's guidelines they should be transferred from a wheelchair. So it's very specific to the actual people that you're working with.
Thank you. That's actually very comforting to know. I guess the reason why I ask is because when you're dealing with such a population, it would seem as if, especially coming from the Department of Health, that there's a lot of requirements that are made clear with any servicing contract. I only have experience more so with the city, but I know the state is its own sort of operation in itself. Having gone through, I guess, the process for some time now, what would you say has been some of the difficulties in trying to, I guess, find housing for the individuals that are being serviced by your program?
It is a great question. So I would say, to be frank, it's monetary. So, these are individuals that are receiving Social Security income or Social Security disability. So like somebody, for example, as a senior citizen or somebody that's on a fixed income, they are on a fixed income. And so that can be challenging at times. But I think that what happens is that's why you wound up, it's very hard, for example, if somebody wants to, for example, live alone, right? So just like, and I apologize, but when you're younger and maybe you're in your 20s, you really want to have your own apartment, but you can only afford so much. So you have a roommate because two of you can share the rent together. And that's sort of the same here, because one person's fixed income of Social Security disability money may only be a certain amount of money a month. And so the challenge sometimes is to make sure that you're finding a home that can accommodate two people and this is their combined income, or three people and this is their combined income. Sometimes it's more difficult than other times. But that, and I will say that it's hard because, it may be somebody that means, for example, I mean, this has nothing to do with Manhattan, but right now, I have three people who use a wheelchair, and I'm trying to find a home in Brooklyn that's one level because they need to be able to, it needs to be wheelchair accessible. Not easy finding a wheelchair accessible home in Brooklyn. So these are some of the challenges, but we navigate them as best as we can.
Thank you. And I guess to follow up on that, it seems as if then the sort of cost of living, specifically dealing with housing, tends to come from, or rather it gets covered by the client's SSD money. Is there perhaps funding that's specifically allocated by the state to your organization to assist with it? Or does it solely get left to the client at that point to then, utilize whatever money they might possibly have?
No, it's all Social Security. That's why, as a nonprofit, what we are doing is contingent upon that. There, as just like with anybody else, we fundraise and donations, but there is no other state funding. There is no other state funding, so we get creative, and we actually, funny enough, I should probably advertise. Regina, you may. We do an annual fundraiser in February of every year. It's called Cupid's Chase, and we do, it may be virtual this year with everything going on, but we do this, fabulous marathon where we have, we do it in Valentine's Day weekend every year, and these runners are sponsored, and we have prizes, and it's a wonderful fundraiser. Virtual this year, but that's what we do, and we apply for grants, and we do as much as we can.
Thank you for updating us here about this. I guess one of the thoughts that comes to mind is, if New York State has any sort of funding that it allocates towards supportive housing for the clients when it goes before the nonprofits, or might have set up a program previously that might not necessarily have continued to today, because I kind of feel the concern there, as you're mentioning, that the clients really have to cover their own expenses, especially when it's really the state, the SSD funding, especially, not to mention, like you're saying, New York City rents. Has there been any sort of program that might have been supportive of the creation of supportive housing or the usage of supportive housing prior? Has it been?
Yes, HUD. So I'm dating myself, but I've been in not with Community Options too long, but I've been in nonprofits in New York for 21 years. I was primarily in the Bronx and Westchester, and back in the 80s and 90s, we would apply for HUD mortgages, and that's how, and I'm sure you guys are all familiar with HUD, but that was really how, primarily before Social Security, disability finally said we need to make sure that these guys have room and board included in their disability money if they want to live in the community. We would apply for HUD, for residential homes.
Can I ask, given that now it sort of seems, and correct me if I'm wrong here, it seems as if you've been focused on kind of a scatter site sort of method, where you go to individual buildings across New York City to try and find apartments for the clients. Has this caused any I guess greater difficulty housing the clients rather than having a supportive housing model where you have a building that's created? Like, for instance, I know the Bridge, they get a great deal of money to have, I think it's roughly around 1,300 clients being housed within supportive housing buildings that got a lot of money, I believe, roughly 20 years ago from New York State. Has it caused difficulties for the operations on your end to not have this sort of supportive housing?
So I'm not sure I understand the question. You referenced the Bridge?
Yes, the Bridge is another organization that does similar work, as far as I understand. They're specifically, able to own very large buildings where essentially their clients are housed, and there's a deal of funding that's been received years ago. I'm not sure if that funding has kept up for them specifically, but I was wondering, given that you're not in this sort of very same situation as perhaps another organization such as the Bridge, does it cause perhaps more difficulties in housing the clients, in this current model of, I guess, what would be considered scatter site?
Well, without knowing what the bridge is, I'm not sure I could speak intelligently, because if I don't know what the bridge is, I apologize. But, housing people with intellectual disabilities in one building, as you say, I'll be frankly quite honest, it sounds like an institution, and Community Options doesn't operate institutions. So
yeah, the bridge is a mental health agency, and what they have carry is the apartments that individuals, which are to them are clients or patients, live in them, and then they have all of the services within that building. So doctors, psychologists,
it's a psychiatric
it's totally
center.
different.
Okay,
Yes.
Right. So just to answer your question, sir, thank you, Regina. That is what is referred to, I guess, under OMH, which is Office of Mental Health, probably, and is probably deemed some like a psychiatric center, and that's not what we do. So we're two totally different entities.
Okay. So how might that then differ in regards to the services that are being offered to the clients?
How might it offer? Well, I'm not in the OMH space. I'm not sure I could speak to what OMH does for their patients. You know what I mean? I apologize. I've never worked in that field. I've only worked with OPWDD.
Oh, okay. Thank you so much. Okay. Sorry, and yes, I just want to give some time to fellow board members if they also have questions. Okay. So I guess for me, I want to try and better understand as well the sort of relationship that's been ongoing between the organization and as well the buildings where perhaps the organization might be renting out units. What does that typically look like? Is there perhaps a community liaison that speaks to the residents of the buildings that are serving as the homes for the clients?
Yeah, Regina is the primary contact, and she asked me to join this call tonight because I am new to Community Options, and I can be of assistance also. So Regina would be the primary contact, and then I can be contacted also.
Okay, great. Thank you so much.
Sure.
So I guess I should ask Regina, what does typically your, I guess, relationship look like with regards to the building's residents where the clients might be staying? Is there perhaps, I guess, a sort of maybe a monthly meeting that might go on that kind of...
We are involved as far as receiving notifications, things like that, from the management and the board. And we have just started to have more communication with the board through meetings, which Kerry has been involved with as well. So we do not have, well, we haven't had in the past like a set monthly call where we speak to one another. It's usually when needed.
So it's Carrie, sorry. I guess I can ask. So if, and I apologize because I am new. So if the building, you know what I mean, has regular monthly meetings or however they're structured, we'd love to be invited just like anybody else. I'm not sure that we need a whole separate, I mean, we don't we don't necessarily need to be treated any differently. You know, we're tenants just like anybody else, and we'd love to participate in anything that the building is offering. And if there is something that they want to speak to us separately about, it's pick up the phone or drop a line, and we'll be more than willing to chat.
Thanks. Yeah, I asked because I generally want to understand what's kind of the community building relationship. I know that I've done a great deal of community outreach, so I just want to better understand what it might look like on your end. Perhaps if there's maybe, you know, that kind of fundraising event that goes on with the community that you work with. Maybe there's some sort of activities that, you know, the building members might all engage in, things like that. So yeah, thank you.
Sure. We'd love to. We'll share all the information about our fundraiser, and we'd love to invite everybody.
Thank you. So I guess with this, if there are no more questions from specifically our community members, I'll open this up to then the public. Going once, going twice. Okay. Do any of the members of the public have any questions? Okay. I'm getting silence.
I have a couple of questions. You talked about 24-hour care, and I think that in our building there are basically 3 shifts of 8 hours each, and that can produce a lot of traffic going in and out of the building. And I want to know if sometimes you've had maybe fewer shifts, just 2 shifts a day, or maybe one person who stays for 24 hours and then a different person. I mean, does it always have to be 3 shifts?
Well, there is New York State labor laws, and so no one can just work 24 hours. So it's an 8-hour shift, just like somebody going to work tomorrow, 9 to 5.
Well, okay. I mean, I, of course, would respect New York labor laws, but I know in certain health situations, people, nurses, I don't know if they're LP licensed professional nurses. I'm not sure what the qualification is, but I do know that in certain settings that are perfectly legal, people can work and get paid for more than just a 9 to 5 or 8-hour shift. So I guess you're saying that you don't do that with your agency.
No, we don't. We're not a hospital.
How about home health aides? They don't necessarily do nursing care, but they just do like companion services and stuff.
Right. So we don't hire home health aides because the requirement to be a home health aide doesn't have the same amount of qualifications. They don't have to do a criminal background check. They don't have to do the fingerprinting. They don't have to do anything that we do. And these are not skilled nurses.
Right.
Or nurses aides. Like, those are people that would do home care for, like, personal care if somebody needed personal care, based on maybe nursing needs or whatever.
Okay, well, you talked about how the residents' Social Security disability checks cover everything that your organization does. And I don't know the exact amounts that people get, but I know it's quite meager. And I know that in addition to paying the mortgage, because these are not renters, but Community Options owns the 2 units. And so Community Options has to pay the mortgage, And then there's food and, just the basics, food, shelter, sometimes healthcare, whatever. They sometimes go out for, as you said, maybe employment or a full-time day program. How can that possibly be afforded? And then, there are administrators such as yourself, Regina. How can that be paid for just on 3 people's monthly Social Security checks?
Well, it's a great question. So I have, and I will be more than willing to share it. Under New York State, there's a 365-page manual, which I've read a couple of times over 21 years. It's actually great bedtime material. It's terribly boring, but basically it's all about benefits in New York State, and their Social Security income covers their rent portion. These are Medicaid recipients, because under Social Security disability, that covers their room and board, but they are Medicaid recipients, and Medicaid actually pays for their health care and a number of other services, whether it be their day program or something like that. So Social Security portion of it is their room and board.
Okay. And these buildings were built, our building was built in 2014, so no one lived there before 2014. And you were talking about these HUD programs for mortgages that were available up until the 90s. But, Community Options bought this in 2014. So what kind of funding did they get in that year?
I could not speak to that. As I new with the organization, and as Regina said, she wasn't in the role in 2014. So unfortunately, I don't think either one of us at this point would know.
Mm-hmm. I do have to ask you about the early alert status, because we have read on the website of the OPWDD that Community Options has been placed on early alert. So what is happening with that?
Yes, so that's why I'm here. So I have a strong footprint in New York nonprofits for 21 years, and it's funny that you mentioned that. So it's really what it came down to. So the home that I was talking to about in Brooklyn. So when you can't meet the requirements for fire evacuation, which is what we're required to do, we have to meet that. So we are desperately looking for a home in Brooklyn, because we have people that live in Brooklyn in an apartment in wheelchairs that we have to staff very heavily because they can't evacuate by themselves. So every time they come to audit us, we fail the audit because they can't evacuate by themselves. And meanwhile, all we need is a 1-level home in Brooklyn.
And that's the reason that your organization has been placed on early alert since November 2019?
That's one of the reasons. That's one of the reasons. Fire safety.
And
because technically we don't meet the regulations.
Are there any other reasons?
Yes, we were lacking in nursing care in our Queens region. So we have a home where we take care of people who are very medically frail, and they are all on feeding tubes. And they felt we needed to have more nursing. And we've since now staffed the home with 24-hour nursing.
So is there any time soon that you're going to get off of early alert?
From your lips to God's ears. That's what I'm hoping.
You know, in our building, this may have predated your starting with the organization, but in our building this summer, 2 of the residents, 2 out of the 6, were removed. You chose to remove them. And I think the reason was because we notified you that there were big problems for a few months, especially with the pandemic. But the worst of it was that one of the residents pulled a knife on our doorman, and he did file a complaint with the police department. And the second person, like a month later, tried to punch him. And fortunately, neither the knife person or the puncher were successful. They were both on video, and they have since been removed. But I don't know what their primary diagnoses were, and I do not believe that people who have developmental or intellectual disabilities are either generally violent or certainly not always violent. So I don't have that bias at all. But I wonder how come these two individuals whose behavior and conduct was really not conducive to apartment living or to the supervision that they had from community options, how were they chosen? And how can we make sure that people like that wouldn't be placed again in an apartment that really wasn't suitable for them?
Well, so one, that's a horrible story, meaning that's terrible. And I was not with community options when that happened, so unfortunately I don't know the logistics. But I guess you know, I guess my first question, and it sounds awful, is I just hope that the person, you know, let's just hope that the doorman or door person, you know, didn't do something to this individual first, and they were defending themselves. So
Yeah,
certainly,
well,
I'm sure
yeah.
you don't know the details, and neither do I. So, you know, it's hard to speak on something like that when I wasn't there, and I'm not sure if you were there, but it sounds like the second thing I heard you say is that the person doesn't live there anymore. So I think it sounds like whatever happened at that time that it was addressed. Does the dorm person still work there anymore?
Yeah, the doorman works there, and we have everything on video. So as far as I can tell, it was totally unprovoked, and not just me, but anyone who's seen the video doesn't think that it was provoked at all.
I would love to see the video. Can I have a copy of it?
Maybe if we can, you know, we'll have. I don't see why not, but I'll talk to you certainly about that another time.
No,
So,
I would love
I think-
to. You know what? It would be very helpful. So I'm a
think
certified
Regina-
investigator. I'm a certified investigator with New York State. So what I do is I do investigations for New York State. So part of what I do is, you know, review incidents and so on and so forth. So if this was filed as an incident report, I can certainly take a look at it. And if there is video, that would be beyond helpful.
Right, but you know, Regina's fully knowledgeable.
So maybe, sorry, if I might interrupt. So if I could just suggest, I think if there's an individual matter that might want to be discussed between the two parties, that might not necessarily deal with the sort of service component that we were trying to talk about, maybe we can have you both connect offline.
Yeah, that's fine.
Sure.
Okay.
Sure, that'd be great. That'd be great.
Yeah. But
yeah, this happened in the summer, and so it's, you know, in everyone's mind, but it's something that did happen, and I don't think it was supposed to happen under the criteria that the state or community options has set for itself in selection of residents. So I just wanted to make sure that it couldn't happen again. Yeah, we can go the specifics offline.
Okay, well, thank you so much, Janet, and folks from Community Options. We do appreciate you having spent the time with us. I guess I will just end the conversation by asking Community Options, what could the community do to also support you, your work, your organization? how can we be of assistance? Because we do know that there's a lot of work clearly going on, and we have definitely not had the opportunity to hear from you. It is incredible opportunity to just learn about the work that you're doing. How can we possibly be of assistance or support you in any way?
I thank you very much, and I know we've taken a great deal of this meeting, so thank you for inviting us. And you know what, the fact that you just even asked that question is wonderful, because we just want to make sure that the people that we support are treated no differently than anybody else. So these are people that, as they got older, that maybe they wanted to live in their own apartment one day, and just like any of our own children would when they get up and graduate college and they want to, but our guys just need a little bit more support, and they may not be able to do it by themselves, and treating us just like anybody else would be fabulous. And we want to be good neighbors. And you know what? Just like in my own home, if my neighbor throws something over the fence, okay, I'll have a chat with my neighbor, and resolve it. But really, just the support and knowing that we want to be good neighbors, and that if there's anything we can do to help and be a part of the community, that's what we would love to do. So I appreciate the time that you've given us.
Well, thank you again for being here.
Excuse me, Ariel. I just had a real quick question. I mean, I guess the elephant in the room is the pandemic and COVID. And I just real briefly, as far as residential communities, has there been any significant impact of COVID on your operations?
I will say that we have done far better than, unfortunately, some of providers, and certainly the nursing homes. And the reason that is because, as Community Options philosophy is that we don't believe in institutional living or large housing like some other organizations. And when you get to live in a small community-like setting, you really stop the spread. I came from an organization where I had homes where as many as 8 people lived there, which would require 4 staff at a time, for example. And so when you have 12 people living together, it's congregate care, and you're naturally going to spread it quicker than anybody else. So Community Options over the last 9 months has done exceptionally well, and that's also because under the Department of Health guidelines, we are held to the same standard and monitored for it. There are days that it's tough. It's some, listen, I have children. It's hard to get my kids to put a mask on every day. And if you have a cognitive disability, it's a little harder to explain to somebody, but we try every day. And over especially the last couple of months, everybody's gotten a little bit more acclimated to it. In the beginning, everybody was, myself included. My kids would not wear masks in the building in the beginning. And I was like, come on, guys, you got to do it. And eventually it's now just the norm, just like for the rest of us. So we've done okay, but thank you for asking.
Hi, Ariel. I was just wondering, in the original meeting that we had, when Ms. Wolkoff brought this issue forward, there was a question in relation to any jurisdiction that community boards might have before. I'm sorry. Is that mine?
If you're not talking,
it's a little hard to hear you. There's a lot of
somebody
feedback.
else's microphone is on.
Yeah.
Yeah, well, I was seeing if maybe it was feedback from my own computer. Maybe my volume was too loud. Is that better?
Much better.
Excellent. So yes, my question was in relation to when this matter first came before us with Ms. Wolkoff earlier this year, or last year rather. We had a question as to what CB12's position would be in relation to this matter going forward, being that we have weighed in, voted on this organization being able to have a space in our community. And we were not quite sure in relation to the concerns that Ms. Wolkoff brought to us, what we would be able to do from this point. So I'm just curious, Ariel, if we were able to get any answers in relation to that.
In relation to what exactly is it?
To whether, because I believe when Ms. Wolkoff first came before us, I'm assuming specific to the matter that she mentioned in relation to tenants in the building being in danger, that she wanted us to help in the form of taking some action. But we were not aware of what ways we would even be able to do so. So I'm just curious if we, I mean, and it seems like this has definitely been a great opportunity for both Ms. Wolkoff, and I'm sorry, I missed the name of the woman that was speaking for Community Options, but to be in a conversation, and hopefully they will definitely take this offline and be able to hash out and work out any differences that exist and hopefully build a relationship. But I'm just curious as to whether we were able to determine what our place would be, as, like whether CB12 would be able to weigh in on what we believe would be a good suggestion, or any other legal dynamics or government related oversight that we might have in that matter. So,
so I think, I mean, and maybe I might have missed something here, but I think it seems as if the concern about the, I guess the individual that might have perhaps engaged with their doorman in a disrespectful or somewhat violent manner, that should have been addressed. The person is no longer at that site. Is that fair to say, or is that?
Yep, that's fair to say.
Okay. So I think that, you know, if there isn't an ongoing situation, or perhaps the allowing for that to continue to happen, it shouldn't necessarily be something that I would necessarily know of perhaps a better way to address that. But I think we all have kind of come to the agreement that we believe in there shouldn't be that sort of interaction, and I hope that that's not the case with any other residents. But I think that what was being brought up between Janet and also the staff members that have joined us is some of the internal conversations about how they might operate, or how they might be meeting with one another. I'm glad to hear that it sounds as if there's going to be a bit more of communication. If perhaps Janet might not have felt that. Again, correct me if I'm misreading things, but that's kind of where I'm at in my mind. Is there perhaps a suggestion that fellow committee members might want to put forward, or?
So just to elaborate a little bit, certainly my question is in relation to this specific matter, but I kind of wanted to know what our, what the opportunity would be, not just in this instance, but in any instance where we have an OPWDD site in our district and there comes about any concerns. I do remember previously with a site that we had in our district, there was an issue, I believe it was with an issue with the fire escape, kind of like what the representative of Community Options has spoken about here today. And because of the issue with the fire escape, it came before us again. And then we did have an opportunity to weigh in that matter. I don't remember in this moment exactly how we did so. But so my curiosity is more towards whenever any OPWDD site has a conflict with the people in the building in which it's placed? What is CB12's or any community board for that matter? What is our position in relation to stepping in the gap again to do anything, whether it be raise the visibility to other elected officials or with the state or anything, or is it out of our jurisdiction? Is pretty much what I was curious about. I mean, and if we don't know the answer at this point, then that's fine. But it would be interesting to know also in relation to what was stated in regards to, I believe there's like a 300-page manual that is good reading material for bedtime. If that can be shared with the members of this committee, that would be great as well, so that we can have that in our collective of information, and we can be able to refer to that going forward. Thank you.
Got it. Yeah. So I mean, I think with regards to many of the outstanding issues that sometimes come before us, I would definitely want to address the matter as we do, and find ways to sort of resolve these sort of issues that arise between our community members. I'm glad again that it's not continuing. I think that if there was ever an instance where we did find any organization in the community that's completely evading the responsibilities, of course I would want to put a resolution. And I think that I spent a little bit late into the last hours looking over some of the past resolutions we put forward dealing with OPWDD. Thankfully, Janet was sharing that with me as well. I think that also has served as sort of a structure, a better understanding as to where things should be with regards to community members and whether it be a nonprofit operating under OPWDD. If ever there was an instance that we're finding that a nonprofit is again not following the sort of understanding that we came to with those individual nonprofits, that they would be a good neighbor, that they would I'll have to go through the resolutions again, but there were a few things that we outlined in them. If ever that was the case, of course, I would want to try and make sure that we were able to provide that oversight and support, and perhaps pass a resolution. So I hope that this is again, this is I think the beginning of an opportunity to start creating this dialogue, working with our partners in the community. Certainly, this is new, I think, for a lot of the committee members. Coming to better understand the work that is being done, the sort of relationships that might be being had in the community, is definitely part of the goal, I think, for me today. Of course, if either individual comes before us and they do find that there's an issue that cannot be resolved, I definitely want to be supportive and help in any way. I think that the past resolution that we worked on, and I was actually talking to Janet a little bit about this too, where we were specifically talking about supportive housing. I felt that is something that is critical to the work that is done by a lot of service organizations. So I want to ensure that we are, of course, advocating for supportive housing wherever possible. I have specifically been doing a bit more research about the scattered site developments, and also, as I was just mentioning, the sort of organizations that operate the way the bridge does. And so that's the reason why I was also asking about, how essentially Community Options has been operating, which way might have perhaps served them, things like that. So, of course, I want to continue advocating as much as possible. If there's something else that comes up that I can perhaps assist with, this goes to everyone. Please let me know. We've just got an agenda that's getting packed. That's the part why I was saying I have a lot of updates to give everyone. But yeah, again, if there's any other suggestions, you know where I am. I'm up to again. I'm checking in. So.
Could I say something really quickly? I know time is ticking, but I just wanted to introduce myself really quickly. I couldn't figure out the mute button at the beginning of this session, but my name is Linda Matueme, and I'm also on the board at Edgecombe Park. And I do think this has been a really great opportunity for members of the community at Edgecombe Park who are on this call to participate in something like this and to hear from committee members who have been serving the district for us, as well as to hear from Community Options, because I do agree that communication has been probably one of the biggest issues in terms of coming to resolutions. So it's great that we've had this platform. It's great to hear, what Community Options does behind the scenes and the standards that, they should be held to. And I think that is something that I want to emphasize, as we move forward with these conversations. Our community is actually one full of healthcare workers. So in 2020, this pandemic has been, has seen, a real rise in people kind of working together to fight the pandemic. And, and I think it's been really good to see that the primary concern for most of the people in our building is really surviving the pandemic, being safe and looking out for each other. We've seen a rise in crime, kind of petty larceny. We've seen, a rise in people trying to take advantage of the situation. So I think ultimately that's kind of what our concerns have been and the reason for bringing it to a community board. I wasn't at the previous meeting, my colleague Janet was, but it strikes me that, everyone's concern is really doing what's best for the community, making sure that everyone is safe, making sure that people are being taken care of, making sure that, anyone who's vulnerable, because in the pandemic, I think the vulnerable have been of greatest concern, so just ensuring that those who are vulnerable, and I would argue that the clients that Community Options serves, fit that bill. We want to make sure that they're getting the service that they need. And it's all of the things that I heard in the presentation earlier, really getting adequate care, proper training, making sure that, they are given the freedom to exercise autonomy, but not to the point where they put themselves in jeopardy. And I think that is sort of what we were seeing in 2020. And moving forward, we definitely want that to be the priority, so that we can, reach that peaceful living that I think we all want. So I really appreciate the opportunity to listen in and, hear this presentation and to kind of brainstorm on solutions moving forward. Thank you.
Well, thank you.
I just realized that I'm on mute. So I was saying, thank you so much. It's a pleasure to meet you in the virtual world that we're in right now, but still a pleasure. I want to thank the folks from Edgecombe, and I always forget the full name. It's Edgecombe Riverside. Okay, Park. And the
Right
staff that came from, and the staff that came from Community Options Inc. I hope you have all had a wonderful start to the year. I hope you will continue to, if ever you have thoughts about projects that you're working on, things that you're doing in your buildings, please come talk to us. We love to hear from the community. I wish we had a different way of gathering, but I thank everyone for being here regardless.
Okay, well, thank you very much.
Thank you.
Thank you.
So with that being said, I am happy to now give the opportunity to the committee to discuss pretty much where we've left off with the concerns about the Fort Washington Avenue Armory, and also trying to get together a resolution that would aid the sort of concerns that we've we've been experiencing for roughly about 6 years at this point. I spent a good amount of time. Phil, if you're there, I hope you're listening. I read through the documents you sent. Thank you. It was quite a bit. But I am so appreciative again that you do all this work. I know it means a lot to Dr. Gary and also the students. Should I say students or the program participants? It's definitely meaningful in the sense that we have people in our community that care so much about servicing others. I went through the documentations. Clearly, it's very evident that you've had the responses already. There's just not been the action that we've wanted. So I am just gonna share my screen, showing just what I've written so far on the resolution. Let me just actually let me open my email so I can pull it up for you. Okay, can everyone see my screen at the moment?
Yes, we can see it.
Okay. So I will read through it. I felt that I tried to document as much as I I generally could in a resolution before being told again that I have written too long a resolution. But clearly this is 6 years worth of information. Let me know if there's additional things that you think should be added. So I wrote, whereas the Fort Washington Avenue Armory is a 233,182 square foot city-owned property converted by the City of New York to serve as a multi-purpose community recreational facility. Whereas the City of New York placed the Fort Washington Avenue Armory under the direct purview of its Department of Homeless Services. Whereas in subsequent years, the Department of Homeless Services decided to lease parts of the property at the Fort Washington Avenue Armory to the Armory Foundation so as to operate an indoor track and athletic facility in the National Track and Hall of Fame and for no other purpose. Whereas in subsequent years, the Armory Foundation received the lease and since then allowed for the usage of space at the Armory to be by Columbia University, New York University, St. John's University, St. Francis College, City College of New York, Iona College, New York Road Runners, New Balance Track and Field, the Police Athletic League, SUNY, and countless other privately run organizations. Whereas the Armory Foundation has for years been using a website page specifically seeking to rent the publicly owned facilities regularly to their clients for corporate or social events, such as corporate functions, galas, bars, bat mitzvahs, weddings, fashion shows, film shoots, and more. Whereas per Article 4 of the license given by the Department of Homeless Services to the Armory Foundation, the foundation is required to make the premises available for use by the Department of Parks and Recreation for the benefit of the community. And whereas per Article 5 of the license given by the Department of Homeless Services to the Armory Foundation states that this license is for the exclusive use of the licensee and solely for the purpose herein above set forth and shall not be assigned either in whole or in part or leased or sublet in any manner without the prior consent of writing of licensor, that being the Department of Homeless Services. Whereas in 2014, Community Board 12 of Manhattan was made aware of its community nonprofit organizations as well as public members' claims regarding the public space not being made accessible by the city-owned Fort Washington Avenue Armory. Whereas in late October 2014, both the New York Daily News and DNA Info both interviewed several nonprofit organizations and reported that they had been being charged tens of thousands of dollars to use the facility. whereas at the October 2014 general meeting, Community Board 12 passed a joint resolution by a vote of 29-0, brought forward by both the Youth and Education as well as Housing and Human Services Committees, noting that a tour had been conducted by city officials finding heavy underutilization of usable space throughout the Fort Washington Avenue Armory. The Community Board 12 supported a discussion determining what entities have the legal authority and responsibility to make day-to-day operational decisions for the facility. And Community Board 12 invited all legal parties that have standing to participate in the meeting, bringing forth all licenses, agreements, and/or related documents. And whereas throughout 2014, Dr. Gary Altime, Growth and Development Services, a local nonprofit organization, leased space by the Department of Homeless Services at the Armory to offer mental health services, has specifically come forward to inform Community Board 12 of their personal experiences being threatened with eviction, denied access to the publicly owned space at the facility, as well as that they were being overcharged for services by the Armory Foundation. Whereas in a letter dated November 24th of 2014, an employee named, and correct me if I'm mispronouncing, Hadaria Morgan of the Department of Homeless Services wrote to the Armory Foundation to inform them it had been overcharging Growth and Development Services, was to respect its right of access to the Armory, had unilaterally raised the fees charged to Growth and Development Services without the written approval for an increase by the Department of Homeless Services, and was investigating the amount of overpayment made to the foundation. Whereas after Dr. Gary Altime and Phil Zablocki met with the Department of Homeless Services in April of 2015, where they stated in person that the Armory Foundation had wrongfully attempted to evict Growth and Development Services, wrongfully overcharged them for services, some of which were never rendered, were delegating Elise Beal, another employee of the City of New York, to assure that the community was given access to the building, informed the Armory Foundation that it was to follow Article 4 of their license, and that Growth and Development Services was to be allowed to use the spaces agreed to prior. And whereas thereafter the public continued to state it had been being barred from accessing spaces within the Fort Washington Avenue Armory without paying exorbitant fees, and Growth and Development Services issues with the Armory Foundation continued to persist. Whereas although the Department of Homeless Services had said they would assure that the community was given access to the building, it then began to evade addressing the aforementioned concerns until meeting with the Housing and Human Services Committee over 3 years later in 2018. And whereas Community Board 12 Housing and Human Services Committee sent a set of 27 questions to the Department of Homeless Services regarding how it had been overseeing the facility, as well as addressing previous issues raised on, and I'll get to that date and event in a moment. Whereas Community Board 12 of Manhattan's Housing and Human Services Committee finally met with representatives from the Department of Homeless Services and requested at the March 2018 meeting that the Department of Homeless Services return to the committee with a set of resolves to address these matters herein discussed, as well as respond to the set of 27 questions sent by Aisha Ogilvy. And whereas the Department of Homeless Services thereafter never returned, continued to evade its responsibilities in the oversight of the Fort Washington Avenue Armory, and then even went on to evict Growth and Development Services without any warning or follow-up, causing long-term disruptions in mental health services that have long been daily needed services for our community's youth. Whereas Community Board 12's Housing and Human Services Committee's past 3 chairs have been pursuing the Department of Homeless Services to answer for why the issues, as just highlighted above, at the Armory have not been addressed for over 6 years. Therefore, I'll take a ginormous breath now. Be it resolved, Community Board 12 of Manhattan calls upon the New York City Council to investigate how the Department of Homeless Services has been overseeing the usage of public space at the Fort Washington Avenue Armory. And be it further resolved, Community Board 12 calls upon the New York City Council to establish by local law a Fort Washington Avenue Armory Board of Directors that would be responsible for overseeing the operational usage of the Fort Washington Avenue Armory, approval of leases to private, public, and nonprofit organizations, and annual financial disclosures. And be it further resolved, Community Board 12 of Manhattan calls upon the New York City Council to ensure the body of the board has a composition of at least 2 representatives of the licensees currently leasing space at the Fort Washington Avenue Armory to rotate annually, 1 representative appointed by the Manhattan Borough President, 1 representative appointed by the City Council member of Council District 10, one representative appointed by the by Community Board 12 of Manhattan, one representative appointed by the Department of Homeless Services, and one representative appointed by the Department of Parks and Recreation. In addition, it would conduct yearly a financial review before the public and make available a report regarding the usage of space within the facility, and would meet at least quarterly throughout each year. And then, let's see here, be it further resolved, Committee Board 12 calls upon the Department of Homeless Services in conjunction with any related agencies to find growth and development services, public space within Community District 12's boundaries, so as to make right the undue disturbance in services that were laid upon our youth seeking mental health services. Clearly that is a lot.
Ariel, hi, this is Etta. Just a quick question. Did you email this? Because I'm trying to find it so I can follow along, but I don't see it. Did you email this?
I couldn't hear the last part, but no, this hasn't been sent over. This was just me putting it together now.
Okay.
But I am happy to send this to the committee members so that
I think
try and read it individually.
Yeah, thank you for putting this together. I could see you do a lot of work, reviewing all the documents. It's a lot to look at the screen that's moving and be able to give you actual comments that are substantive. So if we could have it in writing, I mean, personally, I'm going to print it here so I can follow along, because this is just too difficult to follow along.
Yeah, absolutely. Let me just get this on.
So I want to speak to the committee in relation to this. I feel the same in regards to what Etta stated. It would be good for the whole committee to have a copy of what we are looking at and intending to possibly vote on. To begin with, I have worked tirelessly over many years on this matter. Much of the information that is included in this resolution, I did research for. I helped to lead the team, and please, Dr. Gary and Phil Zabaki, who are on this call, if you can speak to what I'm saying now, the truth of it. I have informed the members of both the GDS organization as well as other community members on the logistics of this. I've talked to government officials, I've talked to elected officials, I've talked to the agency members, both in and out of community. I have lost sleep over this matter because I felt it to be of that importance. There are a few things that should be included in this resolution that, and I, all due respect, Ariel, thank you very much for putting this together. It's a great beginning step for a resolution. I applaud your courage in putting forward this resolution, and I say courage because of the duress that I was put under in attempting to get to this point. There are tremendous pressures from within this very board to not see this resolution see the light of day. It is the reason why I am no longer the chair of Housing and Human Services of this committee. It is the reason why I'm no longer the chair of IT of this board, despite the fact that there were progressive work that I was engaged in that has been completely left by the wayside and not even spoken of or considered because of this issue. It's something that I have attempted to get the oversight of the board specifically, but even the borough president's office and other elected officials to look at. That being said, it is far past time for this to be reviewed. But I think that we are remiss in putting forward this resolution if it does not tell the full story of what has transpired. And part of that is which this board itself has been complicit in suppressing this matter. That being said, there are a few matters that should be included and it would take reviewing the entire resolution to make sure that it's included. I think that they are very important to add. So for instance, that New York Presbyterian also uses that building, not just Columbia University. And I don't know, let me put my glasses back on so I can look specifically, but just off the top of my head, Vera Wang, I believe, used that facility, MTV. There have been other concerts that have been held there, and as has been stated here, all in violation of the contract. I feel strongly, and then there's probably other circumstantial information that should be included in here as well. For instance, even that there was a gentleman that was allowed to use one of the spaces in the building. I don't remember what the square footage of that space is at the moment. However, it was big enough. It was probably almost the size of the office that CB12 has in its current offices. And that space was allowed to be used as an apartment by a gentleman that lives in California. Dr. Gary Altheim or Phil Zablocki may remember his name. And he basically would use it when he flew in during track season specifically. But despite the fact that he was mostly there during the track season, the entire year, for years, and I believe it was for at least 7 years. And the reason why I say at least is because during my investigation of this, I requested from Dr. Gary Altheim, as well as the original photo of a queen size bed in that space. And the longest standing photo that we could find was 7 years ago, but that just means that it actually predates when that photo was taken. That is just when the picture was taken. So I quantified what the loss to the community may have been, only considering standard business hours, not the full, the standard business hours, not actually. Sometimes the schedule changes to allow for more time in the year, where maybe that space could be accessible for more hours. So I used the most modest calculation, and I came up with 36,000 hours lost to the community for that space to be used for other purposes, including all of the types of things that when we put forward our budget rankings annually, that we are begging the city for resources, funding, and space to be allocated so that we can better serve our community. And instead, for at least 36,000 hours over years, a man was allowed to have an apartment in a community, which we are the Housing and Human Services community. We have issues with finding affordable housing for the people that live here. These are the types of things that I've attempted to address. And instead, I ended up being targeted. I feel strongly that I'm still subject of that exact type of targeting. It has infected my experience here with Community Board 12. It is only because my commitment to my community that I continue to exist in this board to this day. So it's for that reason that I feel like this resolution should be a true reflection of what the complicity has been in this regard, but definitely be an accurate demonstration of the evidence that has been gathered. I am willing to participate in that and provide that. Fortunately, we do have, over the time, one of the things that I did is I moderated groups on Facebook. I believe that we have at least 3 different groups on Facebook where we gathered information, including the contracts, including the research about the types of organizations that were allowed to access this facility in direct contrary to what is allowed by the contract. I believe that Dr. Gary also has placed in the chat here some of the ways in which his organization has been marginalized by the wrongdoings of the Armory Foundation. I want to put forward also that after our previous meeting with Dr. Gary Altheim, where this was brought up, Gladys Aquino, who is a member of our board, sent out a letter pretty much attempting to admonish our chair for allowing space for this discussion to be had and not inviting her like she needed a specific invite. That is just a pebble in the sea of types of microaggressions that I have experienced over years. Ariel had one single opportunity to witness it for himself, some of how that manifests from within this board. I also believe that maybe not in this resolution, but definitely there needs to be parameters set so that this never happens again to another board member. It should not be oppressive to the extent where board members don't want to participate when they are attempting to do the good work for this community. And I would like for that to also be addressed. And interestingly enough, there has been efforts been ignored that the birth.
You're breaking up.
I think you're breaking up there.
The letter written by
Aisha, you're breaking up.
And the marginalizations in the board. I'm arriving.
Yes.
Yeah, you're coming in and out. Yeah. So I'll okay. Aisha, I don't think we see you. Once you come back, please feel free to internet issues. Well. Okay. Once Aisha can connect, I'll make sure she has her opportunity to, of course, continue the conversation there. You know, I should say, as you know, being the individual that's in this role, you know, I have tried to convey just how much the work that you are all doing here with me matters. The services that are rendered to this population matters. And, you know, I again can't say ever enough to mention how much I appreciate Aisha. She has, from the very beginning, tried to be a mentor as much as possible since I started on this. There's no reason that government should never be held accountable. Clearly, it's been 6 years. It's been a long time. I tried to share with the entire committee the email that I received the night right after our last. And I've just tried to share it now on the screen with you all. I made it clear in my response to her that it was inappropriate. It was a very clear conflict of interest. If you observe their own financial statements on their website, she is listed as an officer. She should not be using her position as a board member to ask for special privileges while she is a chief administrative officer of that organization. She is making a 6-figure salary. It is inappropriate. So with that being said, again, this is about the community. So you know, I definitely want to continue editing wherever possible. I added in some of the criteria I think Aisha was getting at there. if there is additional information or perhaps an edit that's being requested, please let me know. I'm going to go back to sharing the screen so that everyone can see it. Yeah.
Okay. I mean, I was pretty much coming to the end of my statement, which is just that there is a resolution that was voted on by this board after the borough president put forward her letter sanctioning members of the for their actions. I was named in that resolution that was voted on that should have been enforced has never. Me a text pretty much saying we should just let bygones be bygones.
You're breaking up again.
Happening? It's so strange. I don't know. I don't know. Can you hear me now?
Yeah. I think it's just coming in and out. Yeah. I think you're still continuing. I'm sorry. If you want, to take a few moments, and maybe because I don't know, internet problems up in here in Winter Washington Heights all happen all the time. But if you want to just reconnect your modem.
Can you guys hear me?
Yes.
Okay, thank you.
So do you want to go while we're? And I'm sorry. Should you be able to?
Me, if you were saying it's okay for me to speak.
Yes, please.
Oh, okay. Yeah, I just want to make sure I had permission. No, just two quick comments and a quick question. One is, thank you for doing an outstanding job and putting together a tremendous amount of information. I can personally appreciate the challenge. The second one is, when Aisha was speaking, she had said that, Dr. Gary and I could attest or confirm, everything she was talking about. And I typed in the chat field that, Aisha is correct, but I just wanted to verbally go on the record, being that this meeting is recorded, that everything she says is correct. Everything she's been involved with and, all her statements are correct. And then the quick question I had just for confirmation is, when you mentioned the New York Council, do you mean like all the councilmen and women of New York City? Is that their title when you say New York Council?
The New York City Council. Let's just pull this back up.
I just wanted to confirm who that is exactly. That's all.
So they're the legislative body for the city of New York, and essentially just for every form of government, the legislative body, they are supposed to be that check in regards to the executive. they, specifically can have these sort of hearings where, they can either compel city agencies to come before them and speak to them, because think of it, I guess the same way in which the community board is operating. They're supposed to be that sort of check and balance. The community board was actually structured off of the city council.
So is that comprised of all the councilmen and women that are elected into office? They make up the New York City Council?
Yes.
Okay. Yeah, I just wanted to confirm that. Thank you. That's all that I had. Thank you for allowing me to speak.
Yeah, absolutely. I know my fellow committee members are also looking through this resolution. Clearly it's extensive, but if there's any comments or suggested edits, please let me know.
Ariel, are we voting on this tonight?
Yeah, I would like to vote on it tonight. Let me switch off of sharing just so I can see everyone, because I don't know if people are raising their hands or. Okay. Gary.
Yes. First, I want to thank you and your whole committee for, like Aisha said, having the courage to address this issue after so many years. Actually, for the record, the first time that Dr. Sander tried to evict me was December of 2011. And there's a record of that on Community Board 12. And I approached Maria Luna after that meeting with Angela Ortiz. And 2 days later, I got an email from Dr. Sanders saying that he's no longer trying to evict me. And that was probably the best thing that Community Board 12, the platform that helped, because by speaking up at that point, that was the first time. I do have to say that there's some missed dates, and I would love to have the opportunity with Mr. Zablocki and Aisha to go through the resolution, because there are some dates and there's been so much information. So welcome to my world, Ariel, and Phil's world. And Aisha, I don't know if you heard, but I second the motion of everything that Zablocki said, that Aisha has been through a living hell with this. And it's ironic that the one honest person and that has been truthful for all these years, she's the one that has been the most ostracized and taken advantage of, which is actually very sad. And why I will never give up in terms of advocating for Community Board 12. And this is a great start to address things. Ariel and the committee, I would like to very clearly say that this resolution is problematic in that you have the fox watching the hen house. We have met with several city council people. We have shown the license. I will send you a list of every single person we've met with. And if you're going to create a committee to oversee a building that we have been trying to speak to the very people, Adonis, Mark Levine, Gail Brewer, Carmen de la Rosa, Espiat, we have met with each of them or have correspondences since 2012 with Adonis. We have met with all of them. There has been hundreds of thousands of dollars that has come to the Armory Foundation. I have a database that from different public officials. Robert Jackson gave $1.268 million for the track service when he was a city council. All I'm saying to you, I think it would be a very big mistake not to have an objective person, someone like Mr. Zablocki, who has a nonprofit 501c4. If any person is going to be involved in the oversight of a building that they have allowed to corrupt for so long, I don't think that is a good idea. I'm sorry. But I have spent 7 days a week, 7 nights, besides doing the program, trying to speak to public officials. And like Aisha said, Phil and I and Aisha and Mike Hanno and the other advocates, we shouldn't be doing this. We want to do the work. But I'm very concerned. If you have city council people that we have spoken to, we notified Gail Brewer and Aldrin Bonilla about this license. We tried to do this very nicely with Mark Levine when he was the head of New York City Parks. When he was on the city council in charge of that committee. We went to Steve Simon. We have it in the license. So I am very, very concerned. And I have documentation of every single person that we have spoken to. We have, unfortunately, a lot of documentation. So it is very problematic to have the people, New York Presbyterian Columbia is in the building possibly illegally. They don't have they're supposed to have a license with the city. And the Armory Foundation doesn't have a lease. They have a license. The Armory Foundation could be evicted in 10 days. Community Board 12 could be in that building, a city building. There are so many issues in that building. 1199 got into the building of Jack Pfeiffer's room. Why did they get in? Like Marshall said, this last meeting in December, Marshall concisely said, this is a retaliatory, this seems to be a retaliation. Why did GDS get evicted for 1,200 square feet? So you're going to be asking the same exact people. You're asking the same people to oversee the building that have corrupted it. Columbia does their events there. That they were in there. They're not in there legally. So you have to go one room at a time. It's very, very complicated. And, you know, Shah Ali, I met with him. Again, I have pictures of the meeting with me and him. We tried to address this with him, try to address it with George Fernandez. So if Shah Ali leaves Community Board 12, gets appointed as a judge, and then gets on the Armory Foundation Board of Directors, that seems a little problematic. And then you have Pamela North, who was on the Armory Foundation Board of Directors. They have Maria Luna, who's known about this, who is on the Community Board 12. Glennis Aquino came on the Youth and Ed Committee as soon as after we did the visit to the Armory Foundation. This is very deep, and I think that it should really go to Vanessa Gibson. We tried to bring it to Richie Torres. I don't think that she will touch it either. The Oversight and Investigations Committee. At some point, it's going to take someone out of this network that's willing to stand up, like an Aisha or like you, that it can make sure that this is done right. Nothing more deceptive than an obvious fact. A 2-acre building that was meant to be a community center since 1993. The Armory Foundation is not paying any money. The electricity is being paid by Con Ed. You have Wells Fargo, Yankees. You have all these sponsors. There's something. The resolution is a great start, but if you want the facts and you want to really do a thorough job, we're gonna. I think that Mr. Zablocki should get a chance to look at it before you finalize and vote on it. Thank you for the time, and thank you for your effort.
Thank you so much, and you know, I will say, you know, that's definitely the concerns that I have. That a lot of just, and I should say just the politically scientific way of looking at these matters, right? Because typically, you know, what you'll have is a number of boards that perhaps might have the appointments being directly made by someone, right? And the reasoning for that is just that it's supposed to ensure that, you know, let's just say, like, if it's an elected official, if it is an elected official making those appointments, then that elected official is supposed to be responsive to the public. And in regards to just the general setup of this potential board to oversee the Armory, you know, the kind of resolution that I was trying to put forward is supposed to serve for the long haul, right? Because as much as I believe in Phil will be there. You know, if we're looking at this board to serve for, let's just say, 100+ years, right, going beyond where we are right now, Phil at some point will not, you know, be on this. Sorry, Phil. I'm not trying to get a dark space here, but you know, that's kind of just the thinking that I have when approaching this sort of ideology of putting forward a board to oversee this, right? It's intended to be, you know, meant to have this idea of accountability, and you know, I realize that there's the kind of conflict that you find between what happens in the reality, but also what happens with the the ideology behind setting up this sort of structure. You know,
But these are the exact organizations that have allowed this to happen.
right, right. So if
Can you hear me now?
Yes.
I'm sorry, finish your sentence, sorry, I'm sorry.
sorry, Aisha, are you on the phone or?
Yeah, because I don't know what's going on with my.
Okay, gotcha. Yeah, so I was just going to mention that, you know, that's kind of where my thinking is. How do we try and get a sort of sustainable structure? Sorry, I'm closing my window because there's all the bikes out. But yeah, it's just that, you know, how do you try and keep this so that it's maintainable, right? You have a structure in place so that, you know, if again future leaders are supposed to be coming onto this board, who is supposed to serve on them? Who's supposed to, you know, hold them accountable? That's kind of just the question. So I mean, if you have a suggestion for how I might, you know, edit that sort of result.
I do have suggestions. I think it begins with the Department of Law, which has oversight, from what I understand, in regards to the contract requirements of the building. And in the contract, there is statements or clauses that speak to what some of the governance was supposed to be. It is definitely and obviously, or can be said that contract didn't go far enough with specifying exactly what the governance should be. But in the research that we were doing, we learned that there are city council committees that should have oversight. I think we ended up narrowing it down to 2 different committees that might be those committees that have oversight over what is supposed to be happening with contracts that the city has over facilities like this. So there are probably still questions that need to be answered. Some of the 27 questions that were asked that we never got full answers to, probably some of those still need to be answered for us to have a full understanding of what should be in place in the Fort Washington Armory. So, but I also wanted to go on record in stating that it is a complete falsehood to state that the 3 chairs under which I have served have worked to bring any form of transparency or to support what is appropriate and fair or suitable for our community at the Fort Washington Armory. That is not something that I would support in voting for this resolution.
Sorry, you're talking about a whereas or
in one of the whereases, it's that the 3 chairs worked to bring visibility to this issue, and that is not true. I think that would be a mischaracterization of the facts. The ways in which they may have involved themselves was completely by force.
Sorry,
my own personal duress.
I think it might have been misunderstood. I was referring to the committee chairs.
Even so, one of the specific chairs, Faye Floriman, was the first person that I experienced pushback from in regards to transparency for this. Oh, and there's also, I believe it says that there's a general meeting vote of 29-0. That was not a general meeting vote. In fact, that was a youth and education committee meeting where Richard Lewis was present as the chair of Housing and Human Services. I have a picture of it actually on my wall here at my home when we took in that committee. That is where the 29-0 unanimous with the community and the members of the committee, including the chair at that time. However, before I could walk out of the door, being happy that finally something is going to be addressed where that facility is concerned, Faye Floriman said to me, you know that that's not going to go to the general meeting, don't you? And I said, what do you mean? Why wouldn't it? Like the community just voted. How is it not going? She says, well, Maria Luna is not going to be happy. And at that time is when I learned Maria Luna was on the board of the Fort Washington Armory.
So it's not general meeting, it's actually a committee meeting. It never made it to the general. That was the beginning of the intent to suppress this issue, and that was years ago. And here still today, attempting to bring transparency and fairness to this matter.
Okay, so I just changed the text of that whereas so that it's specific to the Youth and Education Committee passing the resolution. But in regards to so I don't know if maybe I might have missed something, but so in the other whereas that's referring to the chairs, it's referring to the committee chair. So like for instance, the chair. So we had it's been years. We had George, yourself, and then myself. That's what I think I've been trying to refer to.
You mean Richard Lewis?
Yes. Sorry. Sorry. Yeah.
George Fernandez was chair of the board at the time.
Yeah, but Richard was the committee chair before you took on the role, right?
Oh, of Housing and Human Services? Yes.
Okay.
I wouldn't say that Richard Lewis attempted to bring transparency to this. It was actually Richard Lewis that removed me from, and I misspoke before, not 2 leadership positions, 3 leadership positions. I was also removed from the Personnel Committee with no reasoning.
Got it.
Due to my vigilance with this matter.
It's been changed to 2.
Can I speak when you guys have a chance?
Yeah.
Thank you. This is Michael Hano. Ariel, I want to recognize you for the amount of work you've put into this, and also your courage to take up this issue. And as I put in the comments, you should be anticipating maybe they're going to call Eleazar and ask him to lean on you to stop going too hard into this issue. That's what's happened in the past. But right now, I think we're in a better position. This Armory Foundation, they're currently facing 2 very serious lawsuits for serious misdeeds on their part. But this resolution, it's proposing something for the future, but it also goes over a lot of stuff that's taken place over a lot of years. And I think that it's very important that when we are trying to lay out all the facts, we got to have everything very, very accurate. Because if we don't, then what they can do is they can attack all these little mistakes we made and make it look like this thing is not really true. Aisha and Gary and Phil, and to some extent I, have looked into this stuff. The 3 people I just mentioned, they've been looking at this much longer over the years and been involved in it. I've been involved less time, but I did a lot of research at one point, and we would be. I think it would be put us in a stronger position to have everybody work on this resolution together to make sure everything's right, and also strategically, as Gary was expressing his concerns, this board that's going to oversee the Armory, that really needs to be, strategized also. What powers are they going to have? How often are they, or how long are their terms for, this and that? It would be good if at least initially Aisha, Phil, and maybe Gary. Aisha as a former chair of housing that looked into this. Gary as a former tenant, long time tenant of that building, his organization. And Phil, who is from the community, has a nonprofit and has been researching this and foiling this and been denied a lot of times the FOIL information he asked for, both by CB12 and the city. They should be on that committee, at least to begin with. But there's so many little things on that resolution that should be worked out before we put it in, because otherwise we're going to get killed just for all these little mistakes. They've got a high-priced law firm defending them in some of these lawsuits, and they have law firm partners sitting on their board. So we have to be very diligent when we throw a resolution together. You can't work on this by yourself and then just have us look at it and say, okay, it's got to be worked on a little so everything's really as best we can do. But again, I want to recognize you for taking this up. Thank you very much.
Yeah, and again, this is not set in stone, right? Like I said, this is the community. This is for you all. So, you know,
And I want to put on the record to speak to what Mike is saying in regards to the pressure that this chair may receive, and then act in kind within this board. Eliezer met with me as the pandemic was coming down. He knows much of the background regarding this. He was on the executive board when many of these actions to target me were taken. He was aware of my position and the things that were happening to me before the actions were taken against me. When the actions were taken against me, I also went to him personally to seek his assistance, as well as other executive board members. As the pandemic was coming down, which is much far removed from me already having been targeted, he asked me to, from outside of the board, to create a movement in regards to the Fort Washington Armory. And my response to him was, he's well aware of the dynamics of the situation. And if anyone needs to be doing a movement, it should be happening from within this board to stop the complicity of this board in this matter. So, and part of the reason why I believe he approached me in that way is because he knows what the stakes are in regards to other people in the political arena where this building is concerned. And so, again, I support what Phil has said, what Mike has said, in what our due diligence is in this matter needs to be. Thank you.
Yeah.
Hi, if I may speak. So I just have a quick question, actually 2 questions. First off, thank you all for speaking about this matter. I guess the question is, how can we ensure, given the past with the public officials, how can we ensure that CB12 can even hold them accountable if, like we said, we've tried to go to them in the past? And also, this is kind of a more logistical question. The last meeting from December 3rd wasn't on YouTube, and I was just hoping that this one would be accounted for on YouTube, because I feel like this is a lot of important information that we're talking. I just want to make sure I have it. Thank you.
Yeah. You know, I unfortunately won't be able to say that, you know, whatever institution that's ever established can ever be truly you know, accountable to just doing the morally right thing, right? And I think that we've encountered that experience many times over, right? My hope is not to give you false hope, and that's partly the reason why I also want to share that there is the kind of political science behind the structure and the ideology of putting forward a board that is supposed to be, like I said, responsible. You know, any member, even if let's just say we did not go with, you know, making it specific to appointments by elected officials, any member, any person can always choose to do the wrong thing. And again, I don't want to try and make it seem as if this is solely about, you know, there's a good politician or good ideology there, but it's the world we live in. So I of course always going to try.
But if there's a track record, I agree with you. How do you know that anyone's ever going to be, like, you know, legit? But if here we have a proven track record and we can give you the evidence that the city that these people have not done anything, then how could we in good faith put them in charge of a building that they've already corrupted? And you'd have to go through each licensee. It's not a lease, it's a license. And each dwelling that's there would have to be first substantiated to actually supposed to be there before. That's what they were supposed to do. They were supposed to come forth with their licenses. I'm one of the only ones that has the license properly. And there is not even a license for the building that has been recovered from 1993 to 2002. This is such a confusing thing, but that's why you just have to focus on one thing at a time. Where is the license from 1993 to 2002? I don't know if that's a coincidence, but that's when I moved in the building. That's when I went to Bob Scaller up at the Department of Homeless Services. The day that Dr. Sander told me, we don't want these kinds of kids in the building, and you're not getting in the building. I never said that to anyone else before because the DHS was my licensee. I'm out of the building now. I don't have to worry about what I'm saying when you speak the truth. He said, we don't want these kinds of kids in the building. He told my wife that as a social worker, the same type of comment. So you can't have the same people that have a track record of corrupting a building since 1993. Like Aisha has said before to me, it's like, where's the accountability? There should be a payback to the community. Do you know how much all the corporations and everyone that's been, part of this, this whole building should be opened up and the Armory Foundation it could be run by New York City Parks. Why doesn't anyone directly talk to the people like Maria Luna or why doesn't anyone ever say boo to the Armory Foundation? I don't understand that. It's beyond me. No one ever says anything. They're not in charge of the building. The New York City Parks is supposed to be running since 1993. This should be in every committee. New York City Parks supposed to be running it. Land use, youth and ed started this. The elders were running on the track. Every single committee is involved with this. I've spoken to Ellie about this. Every single committee should come together, and this should be something that's brought up to the entire community board while you have a new guard coming in. It affects every single committee almost. Why are you paying hundreds of thousands of dollars to Columbia when you have a city building where every committee could be in one of those buildings, in those offices? You have a 2-acre empty building. Why is I don't understand. This is not something I wanted to do. I want to know what's going on with my space. Where's that? What is my space happening right now? Where's the RFQ? There's the 23. What happened to my space? I haven't been able to see kids.
Jump in here real quick? So there's definitely issues specific to the already existing contract, right? Which it can be said that the already existing contract is not strong enough. Clearly it's not, because look what has been allowed to happen under that contract, right? And in fact, the contract has not been renewed. To understand that when the contract is not renewed, then the previous one stays in force. But I don't think that that's a good model for governance of especially a resource like this, because basically what happens is, people, the cat's away, the mice will play type of situation. It's lack of oversight at its best, right? So that needs to be addressed of what's happening where the city is concerned with issuing contracts. Secondary to that is this contract has said already and what has happened despite the fact that that contract has been in place. And third is, what does this community actually need to be in that space? What would serve the community best? I doubt that anyone would agree that someone having a queen-size bed, microwave, and an entertainment center in that space is the best way to serve this community. And that's just only highlighting one of the issues. But another issue is, it is stated that the track floor is pretty much the singular space in that building that I believe that the Armory Foundation was able to run full out. However, it was stated that when they were not using that space, that it should be also available to the community, but they also were definitely not entitled to the other spaces in the building. If you paint that picture and you look just in the one space where I counted 36,000 hours, imagine with all the other spaces in the building, how many hours and what amount of space could have been used by any entity or people in our community for the benefit of the community. And not just the use of the space and the time, but what outcomes that could afford us, what issues that we have to date and have had over those years that could have been remediated by the use of the proper use of that space. It boggles my mind, and it is heartbreaking. I grew up around the corner from that building. I've participated in activities in that building from my youth. So, and lastly, it is my feeling that because of the work that Dr. Gary Altheim has put into this over the years, from even before I was a board member, being consistent and diligent and targeted the same way in which I was targeted, right? Because I not only did this research, not only helped to inform those who volunteered, no one is paid for this, including the community members, gave time to look into what was the issues with this, but I also have spent time with his program so that I could have an understanding of what types of services he was rendering for our community. I continue to be impressed by the work that he does. It is pretty much a 24-hour operation where the ways in which he supports the youth that he is in contact with, because of the type of mental health services he has chosen to give to mostly the members of our community. I have even given evidence of that in the general meeting of one of his students giving her own testimony about the impact to her family. And unfortunately, her brother just recently committed suicide. He volunteered often with GDS, and I feel like GDS was his home away from home. And in his being pushed out from the Armory, I feel like that was something that was taken away from just that one individual, but it doesn't account for all those that have been impacted by it. And I feel like finding him just some other space is maybe not the best that we can do. Maybe the best that we can do is have him restored to the original space, which he has invested his own money and monies that people from our community and outside of our community have donated to GDS so that he can persist in that space. He should be returned to the Fort Washington Armory because of that. So, thank you.
That could be added to the resolution.
So
Can I ask if CB12 can ask the public officials directly why they've signed a letter saying that they would help us get a new space and not one of them has followed through? There's letters that you see from the public officials from the offices that you're talking about. Mark Levine, Gail Brewer, Adriana Espriat, Al Taylor was involved, Mark Levine. They wrote a letter. I sent it to you. And they promised that they first strong-armed us out because the only way that they would help me find the space, according to Aldrin Bonilla, was if I left. Then if I left, they would help. Well, once I left, they didn't help. And now I have 24 years of stuff in the basement of my house. Can CB12 contact those public officials and show them that letter and say, you're appointing people to the community board. You made a promise for mental health services. We're just wondering why you haven't followed through. Forget about, just GDS. It's the services. Just like you said, this isn't about Zablocki. This is when I'm dead and not on this earth. I want GDS to be there for mental health services. Right now, we could be doing mental health services spread out amongst the track or the empty theater. There could be 6 kids in there. Those 6 kids could change their life because they're feeling lonely and sad. There's all this empty space. What's happening right now to the Armory? Why don't you do a tour? Can you do a tour with masks on? Go find what's in my office? I'm sorry. This is I'm so glad that this is being addressed, but it's a big animal. And I agree. We got to go back to the resolution, and you want to get all the facts right because they'll come after you.
Yeah.
Sorry.
No, I've had enough experiences to last me a lifetime. This is just another. But yes.
So I'm curious because a lot of the committee is silent.
I'm sorry?
So I said a lot of the committee is silent, and I'm in this. You've been hearing me talk about this. Some at least maybe not the new members, and I'm pretty sure the new members have been confused by some of what they have seen me put forward in some meetings. This is the background of my angst. So, and it's connected to other issues as well, like the Haven Plaza, for instance, where it was stated that we needed to serve the community, that we had a deficit of space to serve the community. And so they should eliminate street and not allow people to park in a community where we have major parking issues, where right now in a budget meeting, Debbie Navavian puts forth a request for funding because the number 4 bus is being stalled for a ridiculous amount of time, but it would not be if more street space had not been eliminated, because they claim they needed space to serve the community. And yet across the street, we have a 2-acre building that has been monopolized by one organization to the exclusion of all others. So I really am curious to hear from the other committee members on what their thoughts are about this issue.
I mean, if I might just say, you know, being in their shoes, I imagine I'm very lost because I'm not as familiar with this kind of conversation. That's quite frankly the way I was when I was first introduced to this conversation too. So, you know, I kind of understand that, but I don't want to, you know, spend too much more time. I want us to focus on where we are right now. What can we get done? If perhaps, you know, it makes sense to try and set up some time, whether it be over the weekend or in the coming days, to try and meet and discuss some of the concerns that you just raised and maybe put them down to, you know, a set of whereas or and or resolves. I think that's a good starting point.
So I do have a question. There's a lot of information. Some of it I'm aware of a little bit, and a lot of it I actually was not aware of. But do you feel that we have enough information and accurate information to vote on that resolution today? Or do we need to work on that more and come to it next month? And work on that next month, and maybe that's a big issue. I almost want to say that could be like the only item on the next agenda, but that's my feeling about it. I'm not saying we should do that, but I just feel that if there's a lot of missing information, that we should not vote on anything that is not complete. Aisha, you should chime in on this because I feel you know more than all of us on that issue. Okay, we can't hear you if you're talking.
I definitely, can you hear me now?
Yep.
Can you hear me now?
Yeah, we can hear you.
So I definitely, I feel that some of the matters of fact definitely need to be added to the resolution, and that's some of what I was working on at the time that I was removed, which is like a full listing of who we all know has used that space over the years, the ways in which the contract is not being adhered to, the impact that it has had on not just Dr. Gary Altheim, but even other organizations in that building, and what would be a fair process for the use of space in that building going forward, or even what would be an appropriate use of that building going forward for the best for our community. I don't know if keeping the resolution is the best way to put that forward. It may be that we needed one resolution that addresses the lack of oversight over the years in the past and what has happened because of that, and then a separate resolution that says this is what we would like to see in that space for the best support for our community and what its needs are.
Yeah. So it sounds like we're all on the same page.
Yeah, that was an interesting idea, Aisha, to have two resolutions. Because okay,
Okay. So I'm trying to pull some smiles. I feel like I'm letting folks down here, but we're on the same page. We're gonna get something through. It's just gonna take a little bit more work. That's never there. Oh, there we go.
how do you get this? Wait.
All right. So
I want to say you are definitely not letting me down, Ariel. Your work is appreciated.
Everybody unmute yourselves and give them a round of applause.
okay. So
If I could just jump in for a second, I'm sorry. No, seriously, I mean, you did an outstanding job for a first draft on this, and I don't want to make it sound like that we're bringing down the great work that you've done at all by all these things we're talking about, and it's very important that we say that because you, like Aisha said, you haven't let anybody down. This has been a tremendous move forward. It's just, okay, cool, let's just make sure we get this right because we're going to be coming, with the hammer down, and it's time to really hit this hard. So yeah, let's just make sure everything is right, everything is in there, and you've done an outstanding job. I just want to make sure you understand that's what we're saying. We're just bringing these suggestions, to you as constructive criticism per se. That's all. But outstanding, man, outstanding.
Right, bring it. All right. So
it's so complicated but so simple. A city building that was meant to be a community center. A city building that was meant to be a community center has been privatized. It's profit over people. It's so complicated, and that's why they got away with it. But it's so simple. It's very simple fact, but it's been so complicated. It's so much information. So I just want to say thank you, and I think this is a great start because this is not going away. I think we've proven that.
Yeah. So I'm gonna now take some time to start hitting into the new business. As I was mentioning at the beginning, there's a few updates that have come up. So I did share this with both Gary and Phil already, but this is kind of just dealing with the overall relationship, right, that we're going to need to work on within the next few months. I have been reaching out. I spoke to Ebenezer Smith already about the Department of Homeless Services and trying to make sure that we start communicating regularly. He gave me the contact for Leilani Irving. I believe she was the individual that was originally in contact with the community board. She has yet to respond. There's already been 3 emails. Well, there's a lot of dirt bikes. There's already been 3 emails sent out to Leilani. What I will intend to do now, moving forward, is also add in Matt Borden. Once I have sent out a few more emails, I will then follow up then with Ebenezer and make sure that that's also addressed at his upcoming cabinet meeting. DHS has been contacted for both this matter as well as the matter of the shelter because we have still not been given any more information. We literally, and by we, I should also explain, Eliasar and I just got an email right before this committee was to meet from Miguel from the DRC, I think it's Development Group. They're the individuals I was just mentioning in the past meeting who have contacted us about putting forward that shelter at the 3966 10th Avenue location. So there's, a lot that still needs to be discussed further with BRC at this time. In the email, I should note that I sent to Miguel, there was a large number of questions, essentially trying to get at the details of this plan because clearly it's been it's been ongoing for some time. I don't know exactly how the organization operates, but that is easily something that has been set over probably a year to have planned out. So this has been for some time that we have not known. So I have my concerns. I've tried to relay them. Miguel is asking now for a time to speak. So I'll continue to let folks know what I hear.
Wait, we should invite them. There should be a public hearing about that. And I think the community board office knew about it towards the end of the year, because I remember Ebenezer mentioned something about that. And why did they come to land use? Do you know if they came to land use to present?
No, Ebenezer had received it was like a quick note during one of the meetings about a shelter, but he wasn't given any other information.
Did he ask for information? Was there any communication between the office and the developer?
Well, no, it wasn't. Yeah, as far as I understand, it wasn't from the developer. It was just something that was brought up during one of the cabinet meetings. So, I mean, clearly it's like a pass along, like the BRC has not communicated. Or
do you know if the office contacts BRC and asks for information or invite them to come, or
no.
Do you know if Wayne invited them? I think you should speak to Wayne.
I don't know if Wayne has been in contact. I've only again spoken to Ebenezer about this, and as well Eleazar, and so we're now trying to get the information directly from BRC. As far as we understand it, at least from just the the one email we got from Miguel before, it is supposed to be a shelter that's being operated by them alone. So of course I have questions, because you cannot just finance ginormous development with no other income coming into that.
Okay, I think we need to stay on top of that before it's becoming a reality, and we missed the opportunity to chime in. And I strongly recommend for that to become to be a topic of public hearing, because I'm sure other residents have something to say, and they also have to be informed about the nature of the development.
Were you at the general meeting that passed?
Yes, I was.
Not trying to say anything else. It's just because we were discussing this. Eleazar and I have already spoken about it. We're going to be trying to put on a public town hall that's virtual, of course, but we're also going to be trying to reach out to the elected officials about this. One of the other updates was that I spoke to Mariel from the comptrollers, because she did hear about this. They have not gotten word themselves, but she did want us to continue reaching out to them for when we have been able to speak to BRC and assist them in any way possible.
I would suggest to put the pressure on them and put that as an agenda item, even if they invite them, put an agenda item, and if they're not showing up, discuss the situation and what we know or what we don't know and how much we need to know. And what question do we have for them? Because I feel that may be a way to put pressure on them to show up at the next meeting or whichever meeting we decide. So you know what I'm saying? So if they don't reply back to you, we can't come at the February or March meeting. We should put them on the agenda regardless, discuss the situation, and get, or even a resolution to see if they asking them to come in to present. It just seems like things are happening and we are not, it's going to come to surprise us in a very bad way.
Yeah, we've got the same thinking there. So I mean, we're going to be working to try and set up in that call now. So we've gotten the response. Once I've heard more, I'm going to try and set up a date for this sort of town hall. Yeah, I'll be keeping everyone updated as I hear more.
Sorry, if I may just ask a quick question that I asked earlier. Will this meeting be posted on the YouTube? The one from December 3rd. I didn't see it on the YouTube.
Chanel, are you perhaps there and can answer?
Yeah. I'm sorry, what was the question?
Will this meeting be posted on the CB12 YouTube? Because the meeting from
Yes,
December
it will
3rd?
be.
Okay, thank you.
Also, the December 3rd one, the question was also about the December 3rd one. December 3rd is not on the YouTube channel. It's only on Facebook Live. So there's not like a transparency of information about the meeting on December 3rd, which was a presentation by Mr. Zablocki and Zadie and a little bit of myself.
Oh,
Can you put the December 3rd
yeah, we'll
meeting on
put
as
it
well?
up to YouTube, yeah.
Okay, thank you.
Mm-hmm.
What else? Sorry, there are a lot of updates. So I'm gonna be reaching out. Martin Collins also emailed and he has followed up with. So Martin Collins wants to inquire about the property that burned down quite some time ago by the Dyckman 1 train station. It's pretty much been sitting vacant. He wants to see if perhaps we can work with some of the officials to try and maybe put forward a plan to create affordable housing at that site. So at some point, I'll be reaching out to that I guess the developer or the manager. He sent me the contact information for the individual. But the hope is to get their attention. Hopefully, we can have them come to a meeting and discuss perhaps what they might need as well. Because I can imagine they probably took a fairly large hit with that building getting burned. But yeah, that's just one of the things that's also on the, I guess, a future agenda. So I think that should be all my updates. If I have more, I'll probably tell you the next meeting. But yeah, is there any other additional members who had an update right now, or?
Excuse me, Ariel. I just wanted a clarification. That building that burned, what is the location?
Let me pull it
So
up.
Nagel Avenue, I think 100 and.
What is that, like Nagel and Thayer or something like that?
It's a
Between
block
Dyckman
south
and
of Dyckman.
yeah.
Okay, Menito Tavern. Now the lot is cleared, I guess.
I'm trying to look for the email, but I will.
It's a northwest corner. Yeah, Thayer and Dyckman. Thayer and Nagel. I think it's there.
Yeah, okay. I know exactly where that's at. I know where it's at. All
We
right.
got a lot of vegetation going on in there already.
Yeah, well, I mean, I use the laundry. Well, I drop off at the laundromat that's next door.
Oh, sorry. I have the address here. It is 148-154 Nagel Avenue.
Okay, that sounds about right.
Yeah, so I'll be reaching out, but just want to give everyone the update there.
Okay, thank you.
Yeah. So if there are no further updates, neither new, and I guess I should say I'll switch to old, but I don't know if people are going to introduce anything. If there is no more, I am happy to call this meeting to a close. Can I get a second?
Second.
And this meeting is adjourned.
Okay.
Happy New Year. Thank you all again.
Okay, good night, all.